Hi everyone, welcome to another enlightening session on homeopathic remedies. In today's video, we will explore Trillium Pendulum, also known as Wake Robin, a powerful remedy for profuse hemorrhages and pelvic discomfort. If you are a homeopathic student or a practitioner, stay tuned to understand its key indications, clinical applications, and remedy relationships. Trillium pendulum belongs to the Smiliaceae family. It is specially indicated in cases where bleeding is excessive, bright red, and occurs from various parts of the body, including the nose, lungs, kidneys, and uterus. The hallmark of Trillium pendulum is profuse hemorrhages, either active or passive. The blood is often bright red and may come in gushes. It is useful in conditions such as epistaxis, means profuse nosebleeds with bright red blood, menses, excessive, gushing, and occurring every 2 weeks, often triggered by overexertion or prolonged travel. Then menorrhagia and metrorrhagia, means heavy bleeding from the uterus, sometimes associated with fainting and exertion. Then hemoptysis, means coughing of blood in cases of incipient thesis with purulent expectoration and troublesome cough. Another striking feature of Trillium pendulum is the pelvic pain and weakness. The patient experiences a sensation as if their hips and back were falling apart. They feel as if their pelvic bones are broken and they seek relief by tightly binding the affected areas. Trillium pendulum shares many similarities with other hemorrhagic remedies, but it has some key distinctions. Ipecac for profuse bleeding without clot formation accompanied by nausea. Then Sabina, bright red uterine hemorrhage with pain radiating from sacrum to pubis. Next, Ustilago, dark clotted bleeding with stringy discharges. Then Ferrum, pale weak patients with hemorrhage and palpitations. It is also complementary to phos, particularly in menstrual and hemorrhagic affections. Trillium pendulum is frequently used in gynecological and respiratory conditions where hemorrhages are excessive and the patient experiences profound weakness. It is an excellent remedy for climacteric flooding where excessive uterine bleeding occurs during menopause. This educational video is intended for homeopathic students and practitioners. Patients should always consult a qualified homeopath before using any remedy to ensure safe and effective treatment. If you found this information useful, then do not forget to like, share and subscribe for more homeopathic insights. Thank you for watching and see you in the next video. Keep learning and keep growing.